Hey Neve, how are you today?
Hey, Kobe, I'm good, thank you.
Thanks for coming in. Before we dive into everything, how are you feeling?
Um, I'm all right. I'm just a bit frustrated. This knee's been bothering me a lot.
That's totally understandable that you feel that way. And we'll take our time to work through it together. So what's your main issue, I guess, with the knee, more specifically?
So about 3 weeks ago, I tore my medial meniscus during a footy game. I was going to pivot, and then I felt this sharp pain and a bit of a pop on the inside of my right knee. And then since then, it's just been giving me heaps of trouble.
Sorry to hear that. That must have been a really scary experience. I guess to start off, I might just describe my role as an exercise physiologist and how I guess I may be able to help you over this process. My job is to help you recover from your injury through, I guess, safe and structured exercise with the goal of managing, I guess, both your short-term and long-term negative effects that can come along with this injury. And this is usually done through a few steps. Firstly, an initial assessment, which we'll go through today, where I guess I'll look at your movement, I guess your strength, and a few functional limitations, which will help, I guess, tailor the plan and I guess the way we go forward with this to help with your recovery. How does that sound?
Yep, that sounds great. Exactly what I'm looking for.
Okay, so you said it happened during a pivot. That's, yes, a very common way for it to happen. Was there any contact with any other players during this incident?
No, there was no one else around me. It just twisted and then suddenly bang, pain.
Oh, damn. And what happened after the injury? Were you able to keep playing or did you get taken off?
No, I went straight down. It was really painful. I couldn't put any weight on it. And my teammates helped me off the field.
Damn, that sounds really tough. I guess since then, what kind of symptoms have you been noticing with your knee?
Mainly the pain on the inner side of the knee. Sometimes it locks, like I can't straighten it out all the way. And it swells up if I walk around too much.
Yeah, that definitely lines up with the meniscal tear. How would you rate your pain, let's say, on a scale of 0 to 10?
When I'm resting, maybe like a 2. But if I try and twist or squat, it can spike to a 7 or 8.
Is there any clicking or feeling of giving way within the knee?
Yeah, both. The clicking's been happening more. And sometimes it feels like the knee's going to buckle when I move certain ways.
Yeah, that must be very frustrating for you. Have you had any imaging or treatment since the injury?
Yeah, I had an MRI last week. It confirmed a medial meniscal tear, pretty complex one. The doctor said it might not need surgery unless it keeps locking. I've been doing some light physio and taking some anti-inflammatories.
And before this, have you ever injured this knee?
I know this is the first proper injury I've ever done to the knee.
No worries. Have you had any other history of injuries or surgeries in your past?
A sprained ankle in high school, but nothing else major.
All right, no worries. And what is it you do for work?
I'm a second year PE teacher, so I'm on my feet a lot. I've had to modify my classes lately because I can't demonstrate a lot of the movements properly.
I see. So the injury is affecting your work life too.
Yeah, I've definitely had to limit how much I walk and avoid things like stairs, uneven surfaces, and a bit of pain when I'm trying to run a class.
I can imagine it's very difficult to manage. And outside of work, what is your living situation like?
I live with two housemates, and they've been really helpful, especially when I needed to rest the first week that I heard it.
That's great that you have people around to support you. Are there any other medical conditions I should know about?
No, nothing ongoing. I've always been in good health.
Great to hear. Is there any family history of joint problems or chronic health issues?
Not really. Just my mum has some mild osteoarthritis, but she is in her 60s.
No worries at all. And as you mentioned before, you're taking anti-inflammatories. Is there anything else you are taking regularly?
No, I just take some Nurofen if my knee flares up.
Okay, no worries. I guess before the injury, what did your physical activity look like on a normal week, I guess?
So I play footy once a week and I trained for it twice. And I was also going to the gym 3 times a week just for general strength and cardio.
That's a pretty great effort. And I guess since the injury, what does it now currently look like?
I've been doing the rehab exercises the physio gave me and a bit of upper body stuff at the gym. I've kept away from anything too heavy and weight bearing on the knee.
That's smart. Better to be safe at this stage. What kind of exercises and loading did you do in the gym prior to the injury?
Usually mostly legs, with basic exercises like squats and RDLs, leg press, calf raises, and then just some upper body. And the cardio I would usually do was on the treadmill.
Yeah, very nice. So you seem to have a pretty good understanding of the main movement patterns, which is great. Although it sounds like all your lower body work appears to be, I guess, bilateral or two-legged movements. So in the back end of your rehab and I guess post-rehab, adding in a few unilateral or single leg exercises, like a single leg RDL, lunges, and exercises like that could be really beneficial to help avoiding re-injury. Also, to help keep you fit throughout your rehab, we could incorporate some off-legs conditioning options. For example, doing a ski erg seated and progress it from there, just to keep, I guess, you as fit as possible through this time. How does that sound?
Yeah, that's definitely sounds good. My cardio is really important to me as well. So yeah, that's good.
Yeah, great. I'll look to incorporate that. Now, mentally, how are you coping with the injury?
It's been pretty tough. I'm used to being active and always on the go. So being restricted is doing my head in a bit. I'm also worried I'll miss the rest of the footy season.
I hear you. You're in a really tough position right now. Injuries like this can be mentally draining, not just physical. Thanks for being open about that. It really helps shape how we move forward. So, what are your main goals, I guess, with the rehab?
Short term, just reduce swelling and pain and get back to teaching without having to limp. But long term, get back to playing and training for footy without any pain.
Those are really solid goals. Are you open to committing to a rehab program that may go over the next few months?
Yep, absolutely. I want to make sure I heal properly and reduce the risk of this ever happening again.
Perfect. Just a few final checks. Are there any red flags like night pain, fevers, or unexplained weight loss?
No, nothing like that.
Perfect. And in terms of psychological and lifestyle factors, stress, sleep, or diet, have they changed at all in this period?
Just a bit stressed about the season and work, but I'm sleeping okay and eating well.
Great to hear. Thanks for all of that. Next, we'll go through a physical assessment where I guess we see how the knee is functioning and we'll design a rehab plan from there to hopefully get you back on the field safely and confidently. How does that sound?
Sounds great. Thanks, Kirby. I'm really excited to get started.
Perfect. Thank you.